Good evening and welcome once more to this session where it's not really a session, it's more like a congratulatory episode for Dr. Anik Rathee, our colleague who has gotten AIM rank 3, who is sure to get into AIMS this time. Hello, Anik, welcome.
Hello, sir.
Congratulations again on your rank. It's the top 3 in India. How does it feel for you?
Sir, it is unbelievable. I mean, I was actually rooting that I just want to get into top 10 so that I can get a seat, but I did never expected to get in the top 3.
Wow, that is excellent. Then it must be a pleasant surprise for you that you have gotten in. Yeah, the long
Yes,
run
sir.
probably it doesn't matter where you get into, but it does have its perks being a part of AIMS. You will be now getting into the premier Delhi version of AIMS. So I'm sure you must be on top of the world right now.
Yes, sir. Ames has been and is the dream of every medico there is, sir.
Yeah, very true, very true. I still feel at times, that I should have been some SRship, something I should have done at times. That is a feeling that all of us have, to be associated with what you can say as the mecca of medical education across India. So
Yes,
you
sir.
are now
Yes.
going to, have that dream come true. Congrats, Anik, congrats. So just tell us about your journey, how, where you did your MBBS, your post graduation, how you got into surgical oncology. Tell us a little
So
about yourself.
I first did my undergraduation from Government Medical College, Surat.
Great, great.
After which I joined general surgery in BJMC Ahmedabad.
Oh, so you already are having a background in oncology, two of the
Yeah.
places where, already there is a pretty strong oncology background, especially at BGMC. Yeah.
Yes, sir. So in BJMC was the time when I developed an interest in oncology, as during our rounds and even while preparing patients for surgeries, our my PG teacher used to discuss everything, as
Okay.
in what could be the approach of this patient. Will you go for a biopsy or will you directly go for surgery? Should we give neoadjuvants? So that part intrigued me that every patient has a different set of treatment protocol to be followed. And then during the operation even I realized that how different the oncological principles were. Like for example, I can recall the we had seen many right hemicolectomies for benign causes, but
Okay.
once my professor showed me how we go in while following the oncological principles, first identifying the ileocholic artery and then all that dissection, how bloodless the fields were, and sticking to that plane of dissections, or that uh, actually I felt this is something I want to be a part of.
That's great, Anik. Like many of us, in any surgical field, surgical oncology is at the pinnacle for one reason. For that matter, most of the specialties, if you look at it, especially surgical oncology, because of the clean, neat planes, the dissection that is done, the isolation of the pedicles and everything, whatever is done. So that gives us that real good feeling as a surgeon that you're doing the best possible procedure that can be done. So I can see that you have been inspired by the right people. So, how did you start preparing once you got inspired and decided to take up surgical oncology? So,
Sir,
when did you
I
start?
I actually passed out last year. So
Okay,
after that, I studied for NEET for
okay,
around 2 months. But it
okay,
was during that time that I decided that 2 months were not fairly enough to be able to get a good rank.
okay,
So during that NEET preparation, I started watching the surgical oncology videos of DocTutorials,
okay,
and I made notes during that time. And then again, I got back to NEET for the time being. I was able to score a rank of 347
that's a
in
pretty
NEET.
good rank. Yeah,
Yes, sir, but I was not able to get into any of the my likable colleges at that time. So after that, I again appeared for INISS, which was around 20, 30 days later on.
okay, okay,
And I was able to score a rank of AIMS rank of 27 in
okay,
that session. So I was fairly sure that okay, the path was right, but I was able to gauge that which part of my study was lacking during that exam. As
okay,
I was able to, I had studied surgical oncology fairly well thanks to
Hmm.
your videos and the approaches I had learned. But in during that exam, I realized that my general part was slightly lacking.
okay.
So after that, I focused slightly more on the general part during the next session, sir.
That is great. So, that is actually the message that we have to put across to all the aspiring, people who have prepared with you, people who are going to approach for the exams in the coming year and in the next year and so on. So, I would say that most of the people whom I have interviewed, or, whom we have had the happiness to associate with, all of them have said something similar. They have been inspired to do oncology. They took up the DocTutorial subscription, went through the part, and some of them have taken a combined preparation as well, going through Sebastian and Bailey. That helped them really. So that I'm thankful that we were able to help you in this journey of
Yes,
preparation
sir.
in both INISS as well as in NEET, this one, because we keep telling the students the same thing, because the pattern has changed over the last 2 3 years. 3 years back it was completely something where it was subject specific, like urology
Subject.
means it is going to be coming from Campbell, or GI means from Shackelford, and
That is for
all those
Limbat.
GI topics like
Yes,
that.
sir.
So now it is more of a general thing where we find that at least 50% almost, or 40 to 50% in most exams, comes from Sebastian and Bailey, which is like the bread and butter for any surgeon, whichever be the field he's going to be interested in. So
Yes,
once you
sir.
do that, that part is also important. At the same time, take up the specialty of your choice and study in depth in that. And I'm sure that DocTutorials and Team RRM, we have a lot of faculty from all the fields that are there that is helping you do it. So congrats again and hats off, because you had the perseverance. That is more important. We realize more and more that it is hard work and perseverance that is more important,
Yes, sir.
rather than, because he could have taken some seats. Some at 347, I'm
Yes,
sure
sir.
some seats would have been available. Rather than doing that, you stuck onto it. I remember speaking to you the last time you got it, you were still kind of like whether to take it or whether to try. So, I tell the people to follow their passion. If they feel that yes, they want to do it, go ahead, then you will get it, because you are on the right track. It's just a matter of time. The same message which I gave to other people who have just gotten in, because at the time of the interview, we had a lot of people who came in, and we found that they might have just missed it by 1 or 2 marks at the maximum. So it is only a
Yes.
matter of time, and that is what I would like to tell all the others as well. So, any special people you want to thank from your side for in this journey? You would have had a lot of people assisting you across the way, right from MBBS right now till you got your seat.
Yes, sir. The first one would be my post PG teacher, sir. He
Great.
developed the approach of how to approach a patient rather than the disease. My Dr. Pankaj Modi, sir, at BJMC. He would be the first one I would like to say thanks to. Then definitely my parents,
Great, great.
my brother, my wife has been a very big support for the same thing. Also,
Yeah.
my brother-in-law is also doing DNB onco surgery in Delhi right now.
Oh,
So he
great.
has also been a big pillar of support for the same.
Superb. So you'll be able to have a good guidance also on what to do, and he's right next to you. Being in the
Yes, sir.
same city definitely helps, isn't it?
Yes, sir.
So, any other message you would like to give to others who are aspiring, who are wanting to prepare on how to go about things? What would be your suggestions as far as they are concerned?
Sir, what I followed was I had made notes for surgical oncology and then I studied general surgery. But during preparation in the last 2 months, during the daytime, I studied surgical oncology. I focused on it, and at night, approximately 1 to 2 hours I gave to general surgery to keep brushing the tables and the topics.
Great, great. Very,
Also, to go with the MCQs side by side. At least
very,
50 to 100 MCQs are definitely helpful a day.
very true. Especially, I think with the general part, MCQs play a big part, because you can't read it from cover to cover.
Yes, sir.
Just go through the MCQs more often than not, and especially the DocTutorials faculty are preparing it mostly from the recent editions of Bailey and Sebastian. So pretty much everything will be covered, and even for that matter, from Devita, that is what we generally tend to follow. Take the
Yes.
questions from that, which will form the basis. It may not be the exact question, but it will form the basis for some of the answers that keep coming. Of course, as time goes by, the questions are becoming more complicated and difficult, in the sense that it is based on the same basic
They are
concept,
making
but
it
it
more
changes.
clinical as the
Yeah,
time is going by.
clinical scenarios are coming in. So I will still say, for many people, work in the field of your interest, then it will become a day-to-day part of your practice. I'm sure, Anik, that this
Definitely.
work which you're doing is a part of what Dr. Pankaj has already taught you, because you have been learning it right from last 5 years, I should say. Actually speaking, your journey began then rather than now. So that is
Yes, sir.
now clearly visible in the way you have actually conquered this, and you have come out on top. Top three in the country is really wonderful. There is no way you can kind of like take away that effort. So thank you for joining us here, Anik, and supporting us, and being a part of this journey. We were able to help you. You are kind of like that with us in this, and helping other students. That is what It is just probably a question of couple of questions that people have left out more than anything
Yes,
else.
sir.
So thank you again. How was the mock interview? Did you find that useful?
Yes, sir. The mock interview actually helped a lot. I mean, I was very anxious during the last week before the interview. Ki, what should I study? What should I leave out? What will they ask? I even went as far as searching for webinars on YouTube for
Okay.
any clinical questions. But during the last 2 days, the mock interview, it alleviated all the tensions. I mean, I was much calmer due to those. I knew that I had at least once discussed all the topics. You had discussed all the topics at least once, with special emphasis on gynec, which which is definitely left out by most of the surgeons. So,
Thank you, Anik. So we are here to help out everybody, whoever has kind of sought our help. We are there for you, and we will continue. It doesn't end here for handholding during your surgical oncology course. Also, I'll be sharing a link soon where all the current batch can join, and I'll just share a few papers or whatever is there, surgical techniques, whatever it may be. I just keep sharing those in WhatsApp. I have special groups for that. You can, we'll be helping you, and of course, you have my number, and anytime you are feel free to call me with regard to dissertation or anything basically, so life lessons, whatever it may be. See, all our mentors have taught us so many things. So I can still remember the time when I was an intern, when one of my seniors in my college at Stanley Medical College, he taught me, go and prepare the first exam which you write is the one जिसमें कोई भी टेंशन नहीं है, तुम जाके दे देना, कोई भी दिक्कत
yeah.
नहीं है. To start preparing, that is the first thing he told me, and because of that I got in right then into surgery, which was a dream come true for me. At that time people used to sit for 3 4 years at least, because seats were so few. But
Yes,
that
sir.
confidence which he gave me helped me kind of approach. And so that is what we are trying to do from the entire RRM team, either myself or Dr. RRM or Venkatesh or whoever it is. Everybody is on the same thing with regard to the passion for teaching, and we are here for you. If anybody, it doesn't matter if it's oncosurgery, you can approach any of us. We are all there for you to help you out. And congrats once more. Sit back, relax, enjoy for
Yes,
about 2 weeks, because that is equally important, celebrating the moments of success in your life. So sit back and
yes,
relax for a couple of weeks. Then you will start your course, and then it will go on. Life goes on. So that is how it will
yes, sir.
be. So for right now, enjoy and relax. And congrats once more.
Thank you, sir.
Thank you. Thank you so much. Yeah.